Welcome to Elsevier Global Medical News. I'm Heidi Splete, reporting live from the annual meeting of the North American Primary Care Research Group in Rio Grande, Puerto Rico. I'm here with Dr. Mark Cucuzzella of West Virginia University, and he has been studying an inexpensive and simple intervention to help reduce injuries in recreational runners. So, tell us, what can family practice physicians learn from this?
Thank you, Heidi, for taking your time and interest in this. I'm a 20-year family physician, also a 20-year military officer, working with health promotions now for the Air Force Reserves, and passionate about physical activity for life in our patients, because we know we can keep people moving forever and moving pain-free. All this heart disease, diabetes, obesity, we won't cure it, but we'll definitely make a dent, and that is proof. If we can keep people moving for life, that is good. So in running, especially, their injury rates over the last 10, 20 years as legions of runners try to keep running has not gone down. If anything, they've gone up as runners have aged more, developed more degenerative joint disease just by living normally and all their activity. And we know from almost any sport that there's proper technique in that sport. And by proper technique, you'll not only improve your performance, but you might reduce injury. And we know from the disease-oriented world of biomechanics that there are amazingly proper ways that we can move, but they're difficult to teach. So there's one program out there called Chi Running, which out of the multitude of programs out there, to me as a physician, seems to be the easiest one and most efficient one that we could teach as physicians. Not ourselves, but by giving patients a simple book to read. Now, my own personal story is I'm a marathon runner. I've been running for 20 years. I've damaged goods like many of you runners out there. I've had operations on my feet, told not to run. So in my own life, I've tried to learn as much as I can about this, try all the programs myself. So this one to me seemed to be the most intuitive, easy to learn. So I contacted the author of Chi Running, Danny Dreyer, 2 years ago and said, I think you've got something here that we could study that might be profound for all the recreational runners. 500,000 U.S. citizens ran a marathon last year.
And what did you find in your study?
So what we found in the study was, one, we got a tremendous response rate. We sent 25,000 surveys out by email to people that had bought the book through his website or had gone on and said, I want your newsletter. And we got 2,500 back, which is good for an email survey. But the things we were interested in learning about were who was reading the book. Are these elite runners or just more mainstream, recreational runners? Most were recreational runners of various ages, many over age 50. Almost everyone's been hurt, and that's consistent with the literature. About 50% of runners had been hurt in the 6 months prior to picking up the book. And most injuries were from the knee down, shins, feet, knees. We looked at the intervention, and by surveying people that had used this intervention, did they have less injury after? We found profound reductions, and these can be found on the FMDRL website in the link from this article. But the numbers of injuries in the 6 months prior reduced dramatically, up to 90%. The effort levels by learning this technique were reduced dramatically, meaning people did not fight with running. They felt easier. They felt like this was not quite as hard to do. And that was important to us too, because if people enjoy something and they're not in pain, maybe they'll keep doing it. We also found people were able to avoid surgery. That is a huge, huge thing with our aging population. They're told, oh, you need to get your knee operated on. Teach them a few new things about how they run? Maybe they don't. And as to a doc, and an author especially, who's been trying to just find out if this was helpful, that was profound, enough to make me say, maybe there is something to this that we should try to move forward. This was retrospective, so there's biases. This is a retrospective group. This fall we're doing a prospective trial, meaning teaching a group this technique, following them to a similar group doing similar training, and seeing if there's injury reduction, effort reduction. So this is really in the pilot world now. But from this survey, we really found that there probably is something to this.
For Elsevier Global Medical News, I'm Heidi Splete.